First, the Centers for Disease Control and Prevention is confirming a second case of the deadly China virus in the U.S. A woman in her 60s is hospitalized in Chicago after returning home from a trip to Wuhan, China on January 13th. This follows the first domestic case from a man who was in his 30s after coming back sick, heading back to Washington State. And in China, the government is restricting travel effectively, penning in about 40 million people as officials try to stop the virus from spreading. That's basically the equivalent of the entire population in California. So joining us now to discuss is Dr. Daniel Koretz. He's the chief of the Division of Infectious Diseases at Brigham and Women's Hospital in Boston and a Harvard Medical School professor as well. Dr. Kuritzkes, just want to get your thoughts right now on the way that this virus is being managed when we're seeing cities upon cities in China on lockdown. What's your take on the way that this virus has spread so far?
Well, I think we have to keep all of this in perspective. I mean, the big issue here is that this is a new virus, so there's a lot that we don't know about it, and it obviously is spreading. But in the United States, since the beginning of flu season, there have been 12,000 documented cases of influenza, and that's only the ones that have been reported to the CDC. There are probably 10 times that number that have actually occurred around the country. So now we're looking at 800 cases of a coronavirus infection and about 18 or 20 deaths, which is about a 2% mortality rate, which is obviously a terrible thing. But this is not SARS. This is not the Middle Eastern Respiratory Syndrome virus, which causes a 40% mortality rate. So I think everybody has to take a deep breath and just realize we're always going to see new viruses coming out, and we need to take this one step at a time.
Yeah, no, it's a good point. The 2% mortality rate so far versus 34, as you're saying, plus SARS at 10. When you look at it, though, I mean, what about the speed in which this is traveling? Is that something to cause concern over rather than the mortality rate? Is that something that you look at differently in terms of the response? Because the World Health Organization did not issue a public emergency over this yesterday, though some people were wondering why they wouldn't have taken that step as we continue to see new cases now here, too, in the U.S.
I think they wisely made that decision. And I would say, again, it's 800 cases, but in a population of 30 or 40 million in the cities involved. So what kind of incidence rate is that? Certainly, the virus can be spread from person to person. It appears, and again, we only have limited information, that the spread is mostly among close contacts. So household members caring for a sick relative. There was apparently some spread among healthcare workers, which would really indicate a breakdown in infection control procedures where people were not taking appropriate precautions to protect themselves as healthcare workers from acquiring infection from patients they might be seeing. But it's not like we're seeing tens of thousands of cases appearing. I think most of the concern is because it's new and because there have been some deaths.
Dr. Kuritzkes, do you think American citizens should be taking precautionary measures at this point because of the outbreak that we've seen in China? I know the NIH has not said it's going to be issuing any travel bans or anything like that, but do you think that there are precautions that should be taken at this point?
I don't think that the typical American needs to do anything different than what they're already doing. They should remember that we're in the middle of flu season. Everybody should make sure to get a flu vaccine to protect themselves against influenza. And then if you're in contact with people who have respiratory disease, you should be careful about touching your eyes and nose and mouth, and you should wash your hands after you've been in contact with them and before you eat. And that will go a long way to protect you against other kinds of respiratory viruses. But to be concerned that there might be an occasional person who shows up in the United States who might have coronavirus, I don't think that there's anything for people to be worried about here in the U.S. right now.
Yeah, the measured response you're giving us right now is very different than what we're seeing play out in China when we talk about cities on lockdown. Temperature scanners being placed into buildings, especially in Macau, where there are a lot of gamblers in casinos. But when we're talking about the populations in these cities, I mean, Wuhan greatly outnumbers cities like New York City and London.
Right.
When we just look at the sheer amount of people in these concentrated areas. Is that why you think we're seeing China issue some of these measures? Because it does appear that the case on the ground there, based off these measures, is pretty drastic. So why do you think they're taking those steps and steps that we did not see with the SARS outbreak in 2002?
I think it is a somewhat different situation in China, particularly in Wuhan, where the epidemic began, and also because it's now the start of Chinese New Year's, which begins this evening, and they were expecting, tens of millions of people to be traveling back and forth and potentially aggregating in very large crowds, I also think that at least part of the response now is in order to be more proactive than was the case when the SARS epidemic hit in 2002, 2013. It's hard to comment from here on what is and isn't appropriate to be doing in China. I do think that there are consequences of this kind of lockdown. How do you ensure that medical supplies and food and everything else get into the city that need to get there? How do you make sure that people aren't trickling out? Mm-hmm. I just flew back from Bangkok on Saturday and transited through Hong Kong, and they were checking temperatures there as they typically do since the SARS epidemic.
Yeah. Well, glad you weren't running a fever and able to make it back to work normally. But thank you for giving us the update there, Doctor. Appreciate it. Dr. Daniel Koretz joining us this morning. Appreciate it. Hey, investors. Zack Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.